Hello, this is RN Hayes, and we're going to do a central line dressing change. The patient we're going to have today here is Teddy. As you can see, Teddy has on his face mask. He got his little eyes just covering up a little bit. And he has his catheter right here. You see, it's covered with stat lock and the dressing, clear dressing on it. Now, before I get started, I need to do a site assessment. Of course, we're always looking at the patient and doing a general assessment at all times. But also after we do that, we'll look at it specifically at the site itself. We're looking to see if there's any redness, warmth, swelling, tenderness, and any type of discharge. We're also looking for, we're going to do their vital signs, is any rapid heart rate, and of course, in general, increase in temperature. Also, we're going to be looking for any possible complications before and after the dressing. We're going to look for phlebitis, which is the inflammation of the inflammation of the vein. It occurs when the cannula is too large. And what you're looking for is warmth, swelling, pain, and redness. Of course, that's already done because we've done a site assessment. We're looking for extravasation, where fluid is outside the vein. Liquid spreads outside the vein, out from the IV leak into the tissue, surrounding tissue. If the patient says they have a burning sensation or swelling around the IV site, you know something's going on. Air embolism. After we made our connections, we want to make sure the lines are clear. There are no air bubbles. Hypovolemia, increase in blood volume. Once again, if you did a site assessment, you would notice there's a tachycardia. Or once you do your assessment, you would know that the veins are distended. And of course, if we do proper procedure, we want to make sure it's a aseptic procedure, that everything's clean. So if you notice before you do it and after, you're looking for any pain, swelling, and you can't look right after. After you do the dressing, you would probably come back a few minutes later or 30 minutes later, see if there's any pain, swelling, or fever. That being said, we're going to get started. The first thing we're going to do, as always, before you touch the patient, you're going to wash your hands. Next, I would place a mask on myself. I've already placed the mask. On the patient. Next, after we washed our hands, we make sure we have the kit, the CAV kit for the gesturing. You also have a bio patch and skin prep. Now, we need a clean field. To create a clean field, you would open this up. Normally the gloves would already be in there. We put on our gloves. gloves. And also we have to make sure a stat lock is included into the kit. These are clean, sterile gloves. You put a mask on the patient, as I told you before. Teddy has a mask. We've already washed our hands before doing all of this. We'd also carefully remove the catheter and dressing. So, once we did that, we remove the dressing. And if there was a stat lock here, we remove that. We applied our gloves. We'd add a patch to the, we already had a patch, we just started to go. Then after we've done that, this would be impregnated with chlorhexidine. We'll clean around the site. Right here. After we cleaned, we allow it to air dry for 2 minutes. After we allow it to air dry, we apply a new bio patch. And a stat lock. We use skin protectant, use it around it, and apply the transparent dressing. This is our transparent dressing. I've applied my transparent dressing. Also applied the stat lock. After I've done that, make sure I leave a tape on for time and date of when it was done. We will clamp all access lumens and then remove all needles and connectors. We would scrub the lumens in the, with a chlorhexidine pad and let it dry for about 30 seconds. And then we would reattach anything that needs to be reattached. Before we do that, we use a clean swab to clean it off. Thank you.